We've been talking about blood pressure and the cardiovascular system and blood vessels. We talked about heart attacks that are called myocardial infarctions. Now let's talk about something that public health was referring to as brain attacks for a little while. Kind of didn't catch on, but we're talking about strokes. When a patient has had a stroke, they will have a sudden debilitating onset of neurologic symptoms. And this problem, called a stroke, is properly termed a cerebral vascular accident, or CVA. Cerebral, referring to the brain, vascular, referring to the blood vessels. Accident, I guess they couldn't come up with something else, okay? So cerebral vascular accident. Cerebral vascular accidents, that's a very general term. And particularly when it comes to strokes in humans, they have two actually opposite causes. One cause of stroke is a brain infarction. Do you remember when we were talking about heart attacks? And I said a heart attack typically was a myocardial infarction. And we learned that myocardial infarction meant that the muscle of the heart was unable to get any blood because a small artery had been blocked. Well, cerebrovascular accidents or strokes, they can be caused by brain infarctions or a clogging of an artery that leads to the brain. All of the things that a patient will do to increase their coronary health also decreases the risk that they will get a stroke from this cause. So a cerebral vascular accident, when it is caused by infarction, it's bad. However, if a patient that has had this type of a stroke, this infarction type of stroke, if a patient gets to the hospital and is diagnosed quickly within 2 to 4 hours of onset, we do have a medication, an enzyme that we can inject into the patient that can dissolve that clot that is creating a cerebrovascular accident. So a stroke is always a bad thing. This type of stroke is the less bad of the strokes. The more bad of the strokes are hemorrhagic strokes. And hemorrhagic strokes are caused by ruptured aneurysms. Aneurysms in the brain, particularly aneurysms that rupture, the typical underlying cause is high blood pressure, is hypertension. And this is another reason that we want to make sure that our patients take their high blood pressure seriously. However, there is a not insignificant number of people who are born with small aneurysms in the brain. And they can rupture unpredictably as well. Hemorrhagic strokes are worse. Why? Well, we don't have any medication we can inject into a patient that will stop their hemorrhagic stroke. Also, hemorrhagic strokes, it's usually a ruptured artery. And so every beat of the heart, it is pumping a little bit of blood into the skull, and there's only so much room in the skull. So every little bit of blood that gets pumped into the skull is displacing an equal volume of brain tissue and creating increased pressure inside of the skull, pressure on the brain that will cause the death of brain tissue. So hemorrhagic strokes are more catastrophic and more difficult to survive. Infarction kinds of strokes, they can be destroying little pieces of your brain, and it's not even particularly noticeable. Those strokes, they tend to be called mini strokes, but those strokes can be slowly changing the quality of a patient's brain and changing, causing them to lose memories, and sometimes causing them to change some things that we might describe as their personality. So when there is a lot of mini strokes to the frontal lobe and the temporal lobe, we sometimes will get a change so that the people will be less inhibited in their behavior. And, yeah, sometimes you'll see in TVs or movies that you'll see an older person who is funny because they will just go ahead and blurt out whatever it is that they're thinking. And I suppose that is an amusing scene in a movie, but sometimes behavioral changes like that are due to an underlying series of mini strokes that are actually knocking out parts of the patient's brain. Let me just mention briefly transient ischemic attacks, or TIAs. Transient means temporary. Ischemic means that temporarily parts of the brain do not have blood supply and attack. Transient ischemic attacks will be kind of very subtle signs of a stroke, but they go away by the time you get the patient to the hospital or to the doctor's office. Transient ischemic attacks are often early warning signs of an infection in an impending infarction type of stroke. So even though they're temporary, they are warnings that something worse is coming on, and the patient really should be worked up for their cardiovascular health. The last topic before we are ready to take exam 3 are the mechanisms of venous return. We'll go over it quickly because the mechanisms of venous return are the ones that we've basically learned when we were talking about the mechanisms of lymph return. Veins, like lymphatic vessels, do not have much pressure in them. The blood is not flowing quickly anymore, and there is definitely not enough oomph to return blood from your feet up to your heart, so it needs help. There is a little bit of a pressure gradient, but that pressure gradient is very minor. However, there are other things that help. I sometimes forget to mention gravity, but gravity is primarily responsible of getting the blood to come back to the heart from your brain, right? So gravity is draining your blood from the head and neck. It actually is working against you when it comes to your legs, but it helps with the head and neck. The skeletal muscle pump. Remember the skeletal muscle pump? Do I have a picture here? Yes, the skeletal muscle pump. Every time your muscles contract, they squeeze the veins. They also squeeze the lymphatic vessels. And like lymphatic vessels, veins have got valves. So when a little bit of muscle squeezes this part of the vein, that will squeeze the blood up into the next segment of the vein. And then when the muscle relaxes, the blood cannot come back down because the vein will close, the valve in the vein will close. And then the next time there's another step, another bit of blood gets moved farther, right? So remember the skeletal muscle pump. It pumps venous blood back towards the heart, and it pumps lymph back towards the cardiovascular system. The thoracic pump works with valves in the same way, except for the thoracic pump is the suction inside of the thoracic cavity that happens every time you inhale. Every time you inhale, you're creating a vacuum inside of your thoracic cavity, which, yes, pulls air in, but it also pulls blood up from the abdominal region. So the thoracic pump. And also, every time the atrium relaxes, it creates a little bit of suction by itself, pulling blood in from the vena cava and from the coronary sinus. So these mechanisms of venous return, if they don't seem too exciting, it's because we already covered them with the lymphatic system. There's one thing the lymphatic system does that the venous system does not do. The lymphatic system also has a little bit of help from smooth muscle. The venous system doesn't have that. So blood returning to the heart. Great. Yeah. All right. Let's answer a couple of questions. Water and dissolved substances, small dissolved substances, leave the arterial end of a capillary because what? The capillary is slightly leaky. Well, yeah, that's true. It couldn't leave if it wasn't slightly leaky. Osmotic pressure there is less than hydrostatic pressure there. Yeah, the osmotic pressure is not enough, so the hydrostatic pressure pushes it out. Let's read answer C. Osmotic pressure there is greater than hydrostatic pressure. No, osmotic pressure is greater at the venous end of a capillary bed. Okay, so it looks like A and B are both true. 1 and 2 are correct. Sorry, should have said A and B, right? So it looks like D is correct, and yes, D is correct. Which of the following are correct? Edema is excessive interstitial fluid. Well, that was one of its definitions. It can be caused by low blood protein. Yeah, the protein in the blood, particularly albumin that's made by the liver, is creating the osmotic effect that is keeping the fluid out of the interstitial compartment and inside the vascular compartment. So yes, okay. It can be caused by tissue trauma. Yes, every time you twist your ankle, it swells up. That's edema. Yeah, edema can be caused by tissue trauma. Edema can be caused by heart failure. Yes, that's true. Swelling of the ankles and lower legs is a typical sign of right-sided heart failure in humans. So for this one, all of the above are true. What's the primary function of capillaries? To provide blood to various tissues of the body. Providing blood, that's vague. Maybe that's true. To connect the arteries and veins, well, they do connect the arteries and veins. To exchange nutrients, definitely. I made a point of that. To divert blood away from the skin surface when the skin is exposed to extreme cold. No, they don't divert blood. To dissipate heat from the body, well, they do that. Looks like 4 of those answers are right. Well, let's go back to the question. What is their primary function? What is the thing that capillaries can do that no other blood vessel can do? No other blood vessel exchanges nutrients. So the correct answer to this one is 3. Arteries and arterioles can do the other 3 things. All right, that's it. You should now be prepared to take exam 3, study hard, and I will see you then.